Hello, this is Neil Baum on behalf of Dr. Evan Goldfisher and Dr. Jim Gottesman, wanting to talk to you for just a few moments about the concept of using templates to enhance your practice. This video will cover the importance of practice efficiency, several examples of increasing efficiency, and I will then focus on the use of practice or urologic templates. So why is efficiency important? We are seeing that revenues for many of our patients are decreasing. As of January 2021, CMS has decreased the conversion factor about 10%. We are seeing rising overhead costs, and as a result, our incomes are being reduced. By improving efficiency, we can significantly increase productivity and potentially decrease our cost of care. A scribe is an excellent method of enhancing the productivity of our practice because it requires less input and data entry by the physician. Probably the most important aspect of a scribe is allows the doctor to focus on the patient and not on the computer. As a result, productivity increases. There's a significant improvement in patient satisfaction, and also physicians are notably impressed with the concept of using a scribe in a practice. On the economic side, it requires only 1.3 additional patients per day to have a break even for the cost of incorporating a scribe into your practice. Voice recognition software is now available that significantly reduces time required for documentation. It's much faster than typing, and you will find that several of these programs which are available will enhance efficiency and productivity. We are now all familiar with telemedicine. Before the pandemic, less than 5% of urologists were making use of telemedicine. After the pandemic, more than 60% of urologists have used or are using telemedicine. We have learned that there are many urologic conditions where we can safely and appropriately manage these patients without having to perform a physical examination. Technology is also available for authenticating and checking prior authorization approval before the patient is seen by a urologist, which enhances improvement in the schedule. And finally, I'd like to talk with you about the use of templates. As urologists, we see 20 to 30 patients per day, and most of the patients that we see can be easily managed with templates. Examples include enlarged prostate, urinary incontinence, erectile dysfunction, premature ejaculation, hematuria, PSA elevation, infertility, vasectomy, and prostate cancer, just to name the most common examples. This program was created for urologists by urologists. To use these templates, they're very simple. Hopefully they will be embedded into the electronic medical record. To get started, you enter the patient's name or ID, select the specialty that you would like to use, which in our situation is urology. You pick the condition or the chief complaint, and then you click on to generate the task list. This is the BPH template, and you can see it is quite thorough in regards to all of the questions that a scribe or a medical assistant would need to ask a patient regarding their chief complaint. The program also has editing capabilities where if you click on the plus sign, you can then enter data by typing it in, or the scribe can type this in to the data box, and this records a permanent record for the physician to review. This is an example of the erectile dysfunction template. And as you can see, it is quite thorough in its evaluation of this condition. If the patient arrives with two complaints, such as urinary symptoms and erectile dysfunction, you can use two templates, and this will be recorded and archived into the electronic medical records. The advantages of using these urologic templates, it significantly enhances the efficiency in the office. It will provide you with a thorough review of the most common urologic complaints and condition, and it will enhance your documentation. It significantly improves the learning curve for a scribe or a medical assistant or a resident. And it may assist in coding and billing for the urologic condition or complaint. I hope you found this presentation on efficiency, particularly focusing on templates. We would like to share the templates with you. You can reach any of the three of us on the email addresses shown on the last slide. Thank you.